and then we'll post the recording on there and that for everybody else that couldn't make it today. So I threw out one question altogether on the test, and that was question 4 on the original testing about the what can a child do at 10 months. I'd meant to take that one out beforehand, and just didn't. I forgot about it. So that should give you guys extra, it may change your score a little bit. And then we took and made the rationale writing for 5 questions, and that I've thought about maybe adding a little bit more to those, but I haven't decided yet. If I do decide, I will take and have it done today. Okay. So the first question was the nurse caring for a toddler who has recently turned 2 years old of the following behavior by the toddler, which would indicate the toddler is attempting to become autonomous. And the right answer is walks alone, not walks alone around the room. And that, so the rationale for that is the toddler who is developing autonomy wants to feel in control and to perform tasks independently. This would be indicated by the toddler walking alone around the room. Crying when the caregiver leaves suggests possible separation anxiety. Showing off to gain attention and competing when playing games are not behavior suggesting autonomy. So that's where that's at, okay? So number 2, 95% of you got it right, so that should be easy. A nurse is preparing an exam of a preschool age child. Which of the following actions should the nurse take to prepare the child? And it says allow the child to role play using miniature equipment. The nurse should allow the child to role play or manipulate actual or miniature equipment to reduce anxiety and fear related to the examination. So basically, letting him see your stethoscope, him or her, see your stethoscope, see your badge, see the blood pressure cuff, feel it, play with it, you know, that type of stuff. It just reduces the amount of anxiety that the child is going to have. Okay. So question 3, a nurse is collecting data from a 12-month-old infant during a well child visit. Which of the following should the nurse report to the provider? Okay, and the birth weight has doubled. By the age of 12 months, a birth weight should be tripled. Therefore, the nurse should report the finding to the provider. And that, so I mean, that's just the growth of what the child is doing. And if they're only doubled in weight by 12 months of age, they should double in weight by the time they're like 6 months of age. So they're behind in weight, and they're more than likely behind in stature also. So that's a health concern for that child, okay? And that, I think, is one that we don't know. I don't remember if that's one of the ones we wrote for, but anyway. A nurse is assisting with data collection for developmental screening for a 10-month-old infant. Which of the following fine motor skills? Now, this is the one I threw out. And it's grasp the rattle by the handle and uses crude pincer grasp, okay? So that's the one that I threw out. Why it's still showing up, I don't know. But anyway, I'll fix it. A nurse is considering a well baby visit with a 4-month-old infant. Which of the following immunization should the nurse plan to administer to the infant? Select all that apply. And 57% got it correct. I don't like the way they choose the percentages on these, because 95% of you got the IPV, 84% of you got the PCV, and 92% got the rotavirus vaccination, the RV. And only 30% got the mumps, MMR and the varicella. But it's the first three. The nurse should administer the IPV, the PVC, and the RV vaccines to a 4-month-old infant. The first varicella is not until 12 months of age, and the MMR is 12 to 15 months of age. So that's where that's at. Okay. So I'm working with a group of family caregivers of a preschool age child. Which of the following statements made by the caregiver would require further data collection? And my son always wants to eat the cookies for lunch and for snacks. And this one here, preschool children need guidance in selecting foods and snacks. They should be encouraged to eat nutritiously and eat limited amounts of sugar and sweets in their daily diet. And following normal development, preschool children may call siblings names, have imaginary friends, and play by themselves. And that's very much true. Yeah.
The wording on that one is what threw me off, because so like the rationale was that we should redirect them to eat healthy, but the question asked which one of these requires more information, like which one of these do we need to collect more data on?
Right.
Well, obviously kids want to eat junk food, like, and it's your job to redirect them, so you don't need to collect more data on that. Like, that doesn't make sense. The way it's worded doesn't make sense.
You would want to take and make sure that the mother or the parent knows that, well, that isn't a healthy choice, and you're the parent, and you need to redirect the child to eating more healthy foods.
Okay,
like
so you need to make sure that the
apple slices or
is
vegetables.
redirecting.
Yeah, that's
okay.
Redirect.
Okay, that makes more sense. Okay.
Okay. So that makes more sense for everybody. Good. I hope. In working with a group of school-age children, which of the following activities would this age child most likely be involved in? And it's participating in group activities, okay? So the school-age child enjoys participating in group activities and competitive play. The preschool age pretend during play and enjoy telling stories about themselves. The toddler plays with large balls. So, all right. In reinforcing safety teaching to caregivers for school-age children, the nurse would reinforce which of the following for this age group? Wearing bicycle helmets. I see this all the time and it drives me crazy. Kids are out riding around without helmets on. I was told one time by a physician that a child falling off of a bicycle is like getting hit by a car going 35 miles an hour. That's the damage that falling off of a bicycle can do. My son fell off of his bicycle, broke his clavicle. I mean, and he was standing still, fell off of it, fractured his clavicle. It cracked his helmet that he had on, and he got a concussion from falling off of his bike. And and he wasn't even going fast or anything like that. So, reinforce that you need to wear your bicycle helmets, kids. I mean, I know it's not cool, but it's something that you need to make sure they do. Okay. Let's see here. Go to the next page. A caregiver of a 16-year-old male are concerned about the child is spending too much time with a girlfriend and less time on schoolwork. What information might the nurse offer these caregivers about the child's behavior? Hey, it's normal child behavior for a 16-year-old. That's what it is. When identity has been established generally between the ages of 16 and 18 years of age, adolescents seek intimate relationships, usually with members of the opposite sex. Intimacy, which is mutual sharing of one's deepest feelings with another person, is impossible unless both persons have established a sense of trust and a sense of identity. Intimate relationships are a preparation for long-term relationships, and people who fail to achieve intimacy may develop feelings of isolation and experience chronic difficulty in communicating with others. Okay, that's the rationale behind that.
Hey, Bill, can you reread that question again?
Sure. The caregivers of a 16-year-old male are concerned about the child is spending too much time with a girlfriend and less time with schoolwork. What information might the nurse offer these caregivers about the child's behavior? And it's the child has developed his own identity by now. Being able to establish close relationships with girls is important preparation for all of his adult relationships. They should honor his need to be with or talk to his girlfriend as long as he has completed his schoolwork for the day. So that's what the right answer was. Okay. Okay. A parent is concerned that an adolescent daughter has become a vegetarian and will not consume all the food that is needed for growth. What should the nurse respond to the mother's concern? So it's way down here. 84% of you got it right. Vegetarian diet can be healthy even for growing teens as long as they include whole grain products, legumes, nuts, seeds, and low-fat dairy products or soy dairy substitutes. If planned with care, vegetarian diets can provide all needed nutrients. All vegetarians should include whole grains products, legumes, nuts, seeds, and low-fat dairy products or fortified soy substitutes if low-fat dairy products are unacceptable. And it depends on what type of vegetarian that the person is. Some people will eat like eggs or cheese or meat or milk, but some of them won't. And so you have to make sure that that is understood. Okay. A mother is frustrated because her 9-month-old baby is refusing all solid food. She tells the nurse that each time the baby pushes food away with her tongue, she believes that the child doesn't want it. What should the nurse respond to the mother? And it's the baby needs to learn how to move the food to the back of the mouth for swallowing. So catch the food and offer it again until the baby learns this. And so that's one of those things. A baby, when they're suckling, they use the tongue and they push it forward, and that sort of creates a suction. The infant knows only one way to take food, namely to thrust the tongue forward as if to suck. This is called extrusion or protrusion reflex and has the effect of pushing solid food out of the infant's mouth. The process of transferring food from the front of the mouth to the throat for swallowing is a complicated skill that must be learned. If the food is pushed out, the caregiver must catch it and offer it again. The baby soon learns to manipulate the tongue and comes to enjoy this novel way of eating. The child's behavior does not indicate a food allergy or being a fussy eater. The mother should not wait a month to try to feed the baby solid foods. Okay. So, so those of you that have had babies have all seen this, right? Anytime you try to feed a baby that is used to bottle feeding or breastfeeding, and then they try to switch over to regular food, they always push it out. And you just scrape it away and push it back in their mouth. Right?
Yeah.
I mean, that's just a natural reflex for that baby. A 6-month-old has diaper rash. The baby's mother reports the baby's diaper is changed in the morning and before putting the child in the crib for a nap or at bedtime. How frequently should the nurse teach the mother to check the baby's diaper for changing? 86% of you got it right. Every 2 to 4 hours. That's the minimum. To prevent diaper rash, soiled diapers should be changed frequently. Check every 2 to 4 hours while the infant is awake or to see if the diaper is soiled. Waking the baby to change the diaper is not necessary. Okay, and it's cloth diapers. You know, we use cloth diapers for my kids and we didn't have too much in the way of diaper rash because, you know, when they get wet or soiled, they sort of fall off anyway. They go running around without diapers on. A group of nurses is discussing maltreatment. Get my mouth to work. And one nurse suggests that inadequate parenting skills may lead to child maltreatment. The nurse recognizes that sometimes child maltreatment occurs because the parent may have unrealistic expectations of the child. And that's one of the ones that you see. Commonly, abusive parents have inadequate parenting skills. If they have unrealistic expectations of the child, they may not respond appropriately to the child's behavior. And this is sometimes seen when you have a, not an overbearing, but a mother or parent that expects the child to do more than what that child is able to do at that level of age or development. They sometimes expect them to take over some of the parenting actions that they may see, okay? Which situation should the nurse explore for possible emotional abuse of the child by a caregiver? Okay, the caregiver is a 12-year-old reports, I'm sorry we missed Jamal's appointment last week, but he was supposed to remind me to come. That's what I was just saying back one question, because obviously she has unrealistic expectations that a 12-year-old will remember when his doctor's appointment is or when his appointments are. That's not his job. That's the mother's job. Okay. So that's where that can be seen as abuse. Okay. In caring for a child who has been admitted after being sexually abused, which intervention would be included in the child's care plan of care? Observe for signs of anxiety. A child who has been sexually abused may exhibit anxiety, acts of aggression or hostility, or have physical complaints regarding various aches and pains, gastrointestinal upset, changes in bowel and bladder habits, including enuresis or nightmares. In case of incest, it is important that perpetrators not be allowed to visit the child. Weighing the child and testing urine for glucose are not indicated for a child who has been sexually abused. Okay. Okay, a nurse is working with a group of caregivers who have dying children, which statement made by one of the caregivers indicates that this caregiver is in depressed stage of anticipatory grief. I used to love playing board games with my son. Now that just makes me feel sad. And that's going to show that they're in that depression stage of grieving. I actually got to see the lady that developed the 5 stages of death and dying, Elizabeth Kubler-Ross, in Seattle when I was an LPN. So it was a long time ago, 20, 25 years ago. And she talked and it's, you have to go through all 5 stages to get through this and that. So caring for a family that is facing the death of a child calls on all of the nurses' personal and professional skills. It includes offering sensitive, gentle physical care and comfort measures for the child, as well as continuing emotional support for the child and the family, the caregivers, and the siblings. The diagnosis of fatal illness initiates the grieving process in the child and the family. Denial and isolation, she'll be fine without me. Anger and bargaining, if only. Depression, things that usually give pleasure no longer do. And the acute grief, the final acceptance, I will be sad. So you have to work through all those. And it's not like you started, depression or bargaining or anger. You can go between those, move from one to another, back to another, and that so that it goes from one to another. It just doesn't stay in one section and then you move on to the next section. The nurse has recently started caring for a dying child. The nurse has not yet had a chance to discuss the family's beliefs with the child's caregivers. In the middle of the night, the child awakens and is frightened. She asks the nurse what the nurse's religious beliefs are about death. Which response is appropriate? Most religions seem to believe that spirits live on after the body dies. What are you thinking about? Okay. Nighttime is especially frightening for children because they often think they will die at night and they will be alone. Provide company and comfort. Be alert for periods of wakefulness when the child may need someone to talk to. Be honest and straightforward. Avoid injecting your beliefs into the conversation. So basically, you're going to be supportive of that child, and then you might want to talk to the family when they come in to see the child and say, your daughter or your son was asking these questions last night, and I didn't want to inject my beliefs. So you might want to talk about your beliefs with the child, okay? And talk with him about that.
Oh, wish me luck. I'm officially pulling up the
Pulling up the what?
Sorry, I didn't know that I was unmuted. I was talking to my husband about my paper. I'm so sorry.
What are you pulling up here?
My OB paper to get started. I was pulling it up to go over it for when this is done. I'm so sorry.
That's okay, Cheyenne. Okay, going on to the next one. When caring for an infant who is hospitalized with Haemophilus influenza meningitis, an important nursing intervention for the child would be the nurse to check the child's neurological status every 2 hours. The nursing intervention for the child with meningitis are related to the goals of this child, which include monitoring for complications related to the neurological compromise, preventing aspiration, keeping the child safe from injury during a seizure, and monitoring fluid balance. During a seizure, stay with the child, protect the child from injury, but do not restrain him or her. To prevent aspiration, position the child on their side lying position. Watch for and remove excessive mucus as much as possible, and use suction sparingly. Every 2 hours, observe the child for seizure activity, vital signs, neurological changes, and changes in level of consciousness. The child is placed in fluid restrictions if he or she has decreased urinary output, hyponatremia, increased weight, nausea, and irritability. So when a child has meningitis, you want to look for neurological changes, status, because that is what is being involved with a child with meningitis. It's involving their brain, their central nervous system. So they have to be careful with that. Okay. Okay, Isabel, age 7. I think our Isabel's a little older than that, don't you think, Isabel? Has been complaining.
Yeah, a little.
Just a little. It has been complaining of a headache, coughing, and an aching chest. The care provider makes a diagnosis of viral infection. The child's mother tells the nurse that when Isabel first said she had a headache, the child's father gave her half of an adult aspirin, which is way too much for a child. The mother has heard of Rye syndrome and asked the nurse if her child could get this, which statement would be best for the nurse to say to this mother. And this might or might not be a problem. Watch Isabel for signs of lethargy, unusual irritability, confusion, or vomiting. If you notice any of these, bring her to the emergency room immediately so she can be checked for Rye syndrome. So has anybody ever seen Rye syndrome? This is something you don't see a lot of nowadays, but before Tylenol came out, your child had a fever, you gave them aspirin, but you only gave them child aspirin, what they used to call baby aspirin. Now they call that the heart aspirin, 81 milligrams, and that. So that's one of the ones that's out there. Rye syndrome usually occurs after a viral illness, particularly after an upper respiratory infection or varicella, chickenpox. Administration of aspirin during the viral illness has been implicated as a contributing factor. As a result, the American Academy of Pediatrics recommends that aspirin or aspirin compounds not be given to children with viral infections. The symptoms appear within 3 to 5 days after the initial illness. The child is recuperating unremarkably when symptoms of severe vomiting, irritability, lethargy, and confusion occur. Immediate intervention is needed to prevent serious insult to the brain, including respiratory arrest. So it's not something you want to mess around with, okay? Okay, the caregiver of a child who has had difficulty learning to walk. Notice that when the child attempts to pull himself up to stand, he can't seem to get his legs uncrossed and beside each other. When he is in a standing position, he stays up on his toes. This is different from what they saw with their older children, and they are concerned. Further diagnostic tests indicate that the child has cerebral palsy. Which type of cerebral palsy do these symptoms indicate the child has? And it is spastic cerebral palsy. Among other things, spastic cerebral palsy is characteristic by scissoring caused by severe hip adduction. When scissoring is present, the child's legs are crossed and the toes are pointed down. When standing, the child is on his or her toes. It is difficult for this child to walk on his heels or run. Ataxic cerebral palsy is essentially a lack of coordination caused by a disruption of the kinesthetic and balance senses. It is characterized by an awkward or wide-based gait. Atheroid cerebral palsy is marked by involuntary, uncoordinated motions with varying degrees of muscle tension. Children with this disorder are constantly in motion. The whole body is in a state of slow, withering muscle contractions. Whenever voluntary movement is attempted, rigidity, cerebral palsy is uncommon and is characterized by rigid posture and lack of active movement. Okay, so that's where that's at. And in understanding the nervous system, the nurse recognizes the central nervous system is made up of, and you guys all got it right, the brain and spinal cord. That's the central nervous system. So I don't think we have to explain that. Everybody got it right. What information is most correct regarding the nervous system and of a child? As the child grows, the gross and fine motor skills increase. So that's one of the things that you notice that it talks about in the growth and development of a child, is that as they grow, their brain grows, their spinal cord grows, their nerve innervations grow, they start being able to, pick up things, put fingers together, pincer grasp, pick up little tiny things, and it's not just a grab and picking up things. They can actually put their two fingers together and pick something up off the floor. The nurse is discussing the ears and hearing in the child with a group of peers. Which statement most accurate related to the topic? The eustachian tube in an infant is straighter and wider than in an adult. And that's one of the things. It's also in young children. Eustachian tube is straighter, shorter, and wider than in an older child or an adult. Hearing in children is acute, and the infant will recognize the sounds within the first month of life. That's why young children get more ear infections than older children or adults, because as the child grows, the eustachian tube goes from almost a parallel tube to more of a vertical tube, and makes it harder for the bacteria to go up inside the ear and cause infections. The emergency room nurse is caring for a family who lost an adolescent in a violent car accident. Which initial nursing action best helps the family with the grieving process? And it's cleaning and making the deceased presentable for the family. I have dealt with this in my career a couple of times, with making sure that the person is presentable, making sure that the blood and the wounds are covered, put dressings on the wounds if there's wounds, making sure that the person looks as normal as possible to the family. And that's going to make the family seem a little calmer. It's never a calm situation when you have this happen. It's very emotional and very hard for the nurses as well as the family. So, okay. Which physical symptom confirm the child has been sexually abused or assaulted? Select all that apply. And it's a sperm on the body or clothes, stained or bloody underclothing, and inappropriate vaginal opening measurements. For confirmation that a child has been sexually abused or assaulted, there would be evidence of such stained and bloody underclothing, inappropriate vaginal opening indicating intercourse, and the physical presence of sperm. Suspicion of abuse includes the child's statement and suspicious actions. Okay, so that is the review. I'm going to stop sharing here for a minute. And any questions or comments?
Thanks for going over that.
Oh, no problem.
I was wondering, I'm trying to think of a way where, because I think that a lot of us did pretty poorly on this exam. And regardless of the test score, I want to learn this information because I feel like if I went into the NCLEX and had this stuff on there, I wouldn't know it. You think that maybe we could work through a solution to potentially earn some points back by doing like rationales for the ones that we missed, even if it's just earning 1 point back by going through the book and citing the page number and, you know, writing down why that's the right answer versus what we chose?
Yeah, that's what the rationale writing is for, and we've tried to do that in the past. I talked with Andy, and Andy said, you know, maybe give a couple more of the questions that were wrong to add to the rationale writing. So I think that might help. I've got the list of the ones that were wrong that had higher than 50%. Or lower than 50%, I should say. And that, so I think that would be something that we could do. Right, Amanda?
Yeah, so you're saying there was more than the questions that were put on the rationale that could have been used as rationale rating?
Yeah.
Okay, so you're planning on adding those in?
Let's see, I circled the ones that we had. And I would just have to go through them and see which ones are. I'm.
What about, Bill, if we did something like, so, because I think what Ashley was trying to say is she wants to go over all the questions she missed, not just the ones that were 50% or more of the class. Could you leave the test open so that they can look at the questions and go over the ones that they missed and maybe write for the ones that they missed and earn 1 point back for each one?
So
individually, which ones they missed.
So take and do, instead of rationale writing and getting points back at like a rationale writing test, have them submit a paper on all of the ones that they had missed.
Yeah, like each one individually, the ones that they missed.
Right. And then have it graded at 1 point apiece.
Yeah.
I think that would be doable, and give you the same 1 week time frame. Would that be all right?
Yeah, I think that's more than fair. I mean,
so what I'll do is I'll make an assignment that and open up the test for you guys to go over the ones that you missed. And you'll have to tell me which one it was, what number, and then write the question down, write your answer that you got wrong, and then write the right answer down, and then why that right answer is the right answer, and give me a page number.
Okay, Amanda, is there a way to open it so that people can see which ones they missed? Because I'm afraid that we won't.
Yeah, we can make it
We
so
can
that you
open
can
it up.
see what you missed on the test.
Awesome. Okay, yeah, I think that's more than fair. What do you guys think, the people that are in here? Does that sound good to you guys?
We still
I
gonna
think
get
that's
2
a good
points
idea.
back for the original rationale questions?
Yeah,
No.
you'll still get the points back for the original rationale questions, but you have to take, because I can take and look at each individual person and see which questions you missed and which ones you got right and all that kind of stuff.
Okay, so let's be really clear about it, Bill. So if they do the rationale that's open now, they're going to get the points back for that. Then if they do, they shouldn't repeat any that were open for rationale on the 1.1, I don't think. So if you're
Right.
earning 2 points back on the ones that you do for the rationale that's already open, don't redo those ones for the second assignment that's going to open. Does that make sense, Rena?
Yes.
Okay.
So you
That
only
sounds
do the
very
ones,
fair.
you only do the ones that are outside the rationale writing that's already existing
Okay.
that you would miss. So I'm in there
Thank you.
right now, and I'm going to open it up.
Thank you.
You're welcome. I mean, edit it. So I will have it open until the 17th. Did that give you guys enough time?
Yeah, that's perfect.
Yes, thank you.
Okay, so it's now open to the 17th and at 11:59 p.m. So could one of you go out and look and see if you can actually see the scores and that? Just to make sure. That it,
I'm trying to look now.
yeah, try it.
While they're doing that, Bill, I have a question about week 7 quiz on the 36, chapters 36 through 39.
Okay.
Just on number, I don't remember which number it is, but it's one about about UTIs.
Uh-huh.
And everything else is like straight out of the book. So I figured this one would be straight out of the book, and I thought the answer would be anti-infectives. And I did it, you know how you either have to have the right spacing, the right dash,
Okay, let me look.
I
I'm
put
in-
anti-infectives with no dash, but I know someone that did it with a dash and it doesn't work either way.
well, let me-
The answer is antibiotics.
See, that's
Yeah.
I know. That's why I'm like, what the heck? Everything else is like literally directly from the book though. That's why that would have been my guess to put in there.
See, I can go in and I can look at it.
Bill, I have access to the test. I can see it,
You
what I
can?
got wrong and stuff.
Okay. Good. That'll
Thank
work.
you.
Yeah, thank you so much.
Yeah, it's antibiotics, and I've spelled it, but I've also got anti-infectives.
Well, that's what I put and I got it
Yeah, I know.
wrong.
And that, so I mean, as possible answers, because
Yeah.
that's one thing that Canvas is horrible at when you have to fill in the blanks.
No, I know. That's why I just want to make
It's just-
sure.
And I take and, I usually go through these and update them. So I like on yours, I gave you the 1 point.
Oh, okay. So I don't need to
And
redo
then
it.
update your score.
Okay.
So it should be fine now.
Okay. I just want to know too, though, so I can remember, just to make sure that that's
Yeah.
okay. Thank you.
And also for young girls to not get UTIs. It's, you know, don't have bubble baths all the time. You know, wear cotton underwear, you know, wipe front to back, you know, things like that.
Bill, with the doing, you said you threw out question 4, right?
Yes.
Okay.
Yeah, I've got to go back in there. For some reason, when we were going over the test statistics, it was still there. So I'm wondering why it was there. So I have to go back out and figure that out. Anyway, but if it's still there, I will take and just give everybody points for it. So I should have done that the first time, but just give everybody the points.
Bill, do
So-
you want me to make the other assignment for the 1-point questions?
If you want, I can do it either
Okay.
way.
All right, I'll make it and I'll put an announcement for those that aren't here.
Thank you.
Thank you both.
Okay. All righty. So
Thank you. Goodbye, guys.
I'm going to end the recording.
Bye, Bill.
Bye.